Let me start with a simple truth. Not everything labeled as healthy actually is. Take turmeric, for instance. It's been hailed as a miracle spice, anti-inflammatory, antioxidant, anti-aging, you name it. But here's what they don't tell you. Even the best foods can turn toxic depending on what you eat them with. Now, if you're over 60, your liver, kidneys, and gut microbiome aren't the same as they were at 30. Your body's ability to detoxify and metabolize certain compounds changes dramatically. And when turmeric interacts with the wrong foods, it can do more harm than good. Today we're going to talk about 3 specific food combinations that can make turmeric dangerous for older adults. These aren't fringe cases, they're based on biochemistry, not internet rumors. My goal isn't to scare you, but to help you understand why certain combinations disrupt your metabolism, your digestion, and even your medications. Because real health isn't about adding superfoods, it's about understanding how your body chemistry works, and that's where the truth lies. Here's the thing about turmeric, or more specifically, curcumin, the active compound that gives it that golden glow and all its supposed magic. People think they can sprinkle it on everything and suddenly turn back the clock on inflammation, arthritis, or even Alzheimer's. But food doesn't work like that, and biology certainly doesn't. Your body isn't a chemistry set where you can just add a spice and expect miracles. It's a living system, dynamic, adaptive, and incredibly complex. And after 60, that system doesn't run the way it used to. Let's start with metabolism. When you were 25, your liver enzymes were like a well-tuned orchestra, breaking down nutrients, detoxifying compounds, and keeping your blood chemistry in balance. By 60, that orchestra is missing a few players. The liver doesn't process compounds as efficiently, the kidneys clear waste more slowly, and the gut lining becomes thinner, more permeable, and less capable of absorbing nutrients optimally. So when you introduce turmeric into that system, the way it behaves changes. Curcumin is notoriously difficult to absorb. Only a small fraction of what you eat actually makes it into your bloodstream. The rest gets broken down or excreted. That's why so many supplements pair it with black pepper or piperine to enhance absorption. But here's the kicker, that very mechanism, the inhibition of certain liver enzymes by piperine, can become a double-edged sword, especially as you age. When those enzymes slow down, they don't just slow down the metabolism of turmeric, they slow down the metabolism of everything else. Medications, alcohol, toxins, even hormones. So now you've got curcumin and piperine competing with your blood pressure pills, your statins, your blood thinners, and the result can be unpredictable, sometimes even dangerous. That's why saying turmeric is good for you is only half the story. It depends on your metabolic context, your liver function, your kidney function, and your overall inflammatory state. At 60 and beyond, your body's detoxification systems are less forgiving. The cytochrome P450 enzymes in the liver, the same ones that process most prescription drugs, are less active. Curcumin interacts with those pathways. If your doctor has you on medications that rely on those same enzymes, turmeric can interfere with how those drugs are metabolized. Sometimes that means the drug becomes more potent, other times less effective. Either way, you lose control over dosage and effect. Now let's talk about the microbiome. The unsung hero of your metabolism, gut bacteria play a huge role in how you absorb and process curcumin. In a younger gut, diverse microbes can help convert curcumin into active metabolites that exert anti-inflammatory effects. But in an older gut, where microbial diversity is often reduced thanks to antibiotics, processed foods, and simply the passage of time, those conversions don't happen as efficiently. That means turmeric's benefits can be muted or inconsistent. Worse yet, an unbalanced microbiome might even turn those compounds into irritants rather than healers, leading to bloating, gas, or discomfort. Another factor to consider is bile production. Turmeric stimulates bile secretion, which helps digest fats. But if your gallbladder isn't functioning well, something that's quite common after 60, that extra bile demand can backfire. You may experience nausea, cramping, or even gallbladder stress. It's the same principle as revving an old engine. If the oil pump isn't what it used to be, more fuel won't make it run smoother. It'll just wear it out faster. So when people say, just take turmeric every day, it's natural, I wince a little because natural doesn't mean harmless. Arsenic is natural, so is cyanide. What matters is how your body handles it. For a 30-year-old marathon runner, turmeric might help reduce joint inflammation and oxidative stress. For a 70-year-old on multiple medications, it could slow drug metabolism, raise liver enzyme levels, and upset the gut microbiome. The same compound, different biochemistry, radically different outcome. If you really want to use turmeric for its health benefits after 60, the key is moderation and context. Take it with food that supports digestion. Mild fats like avocado or olive oil, not with heavy fried foods. Avoid combining it with supplements or medicines without medical guidance. And remember, you don't need massive doses. Your body doesn't respond to more, it responds to balance. Food isn't medicine, food is information. It tells your cells how to behave. The question is, what message are you sending? At 60, your metabolism has earned the right to be treated gently. Curcumin can still be your ally, but only if you respect the biochemistry behind it. Understanding how your metabolism works is not optional. It's the only way to separate healing from harm. And that's where real nutrition begins. Not in the spice jar, but in the science of your own body. Turmeric by itself can be a remarkable compound, anti-inflammatory, antioxidant, even a mild metabolic regulator. But the problem isn't turmeric alone, it's what we eat with it. See, food doesn't exist in isolation. Every bite you take is a biochemical conversation between nutrients, enzymes, and hormones. And as we age, that conversation becomes harder to manage. The enzymes are slower, the gut barrier is weaker, and the internal balance that used to self-correct doesn't do so quite as efficiently. That's why certain food combinations, especially when paired with turmeric, can shift from healing to harmful, particularly after 60. Let's start with one of the biggest hidden issues: oxalates. Turmeric naturally contains oxalates, and so do a lot of foods. People pair it with spinach, beets, nuts, and certain grains. Oxalates themselves aren't toxic in small amounts, but they bind to calcium in your body to form crystals, the very same kind that make up kidney stones. When you're young, your kidneys can usually flush out excess oxalates without much trouble, but after 60, kidney function naturally declines. The filtering rate, what doctors call the glomerular filtration rate, drops steadily. So when you combine high oxalate foods with turmeric, you're giving your kidneys extra work they can't always handle. Over time, that can mean mineral imbalances, calcium depletion, or in the worst cases, kidney stones. Now, let's add another common mistake: eating turmeric with excessive fats, especially the wrong kinds. Curcumin is fat-soluble, which means it's absorbed better with fat. That's why traditional Indian cuisine often pairs it with ghee or coconut oil, natural fats that your body can metabolize efficiently. But modern diets have twisted that wisdom. Today, people are adding turmeric to deep-fried foods or oily curries made with refined vegetable oils. Those industrial seed oils, canola, corn, soybean, are high in omega-6 fatty acids, which promote inflammation when out of balance with omega-3s. So instead of reducing inflammation, you're creating a tug-of-war inside your body: curcumin trying to lower inflammation, while the oxidized fats in your meal are stoking it right back up. The result? Your liver has to work double time to clear out lipid peroxides, bile acids, and free radicals. For a 65-year-old liver, that's like asking an old engine to run on bad fuel. And then there's sugar, the hidden saboteur. You'll find turmeric lattes everywhere now. loaded with honey, maple syrup, or worse, refined sugar. The irony is painful. Turmeric's primary benefit is reducing chronic inflammation, and yet we're mixing it with the single most inflammatory substance in the modern diet. Sugar spikes insulin, raises triglycerides, and activates the same pathways that drive oxidative stress, the exact problems turmeric is supposed to counteract. If you're over 60, that sugar hit also comes with a slower insulin response, meaning glucose lingers in your bloodstream longer, damaging cells and blood vessels. Combine that with curcumin's impact on certain liver enzymes, and you get metabolic confusion. The body can't decide whether to store, burn, or detoxify. There's also a gut-level problem. Many people mix turmeric into meals rich in cruciferous vegetables, broccoli, cabbage, cauliflower, thinking they're doubling up on health benefits. The idea sounds great on paper. Combine antioxidants with detoxifying compounds. But for older adults, this can cause gas, bloating, and digestive distress. That's because both turmeric and cruciferous vegetables can stimulate bile flow and gut motility. In a young, balanced digestive system, that's cleansing. In an older, slower one, it can be overwhelming. Your gut lining becomes irritated, the microbiome shifts, and instead of absorbing nutrients, you end up inflamed and uncomfortable. Let's not forget about protein either. Turmeric is sometimes added to high-protein dishes, meats, or protein shakes, under the assumption that it'll help reduce inflammation caused by animal fats or exercise. But when protein digestion is incomplete, which is more common as stomach acid levels drop with age, the undigested peptides ferment in the gut. Add turmeric to the mix, and it can intensify that fermentation process, producing gas and reactive compounds. Again, context matters more than content. The broader lesson here is this: turmeric doesn't act alone. Every time you consume it, it's interacting with an entire biochemical network: fats, sugars, proteins, and minerals. The problem arises when those interactions demand more than your body can supply. A healthy metabolism can adapt to minor mistakes. An aging metabolism, however, has less room for error. It's like running an older computer. You can't keep opening new programs without slowing everything down or crashing the system. So what's the right approach? If you're going to eat turmeric, pair it with gentle whole foods, lightly cooked vegetables, clean proteins, and natural fats. Avoid combining it with high oxalate greens in large quantities. Skip the refined oils, and absolutely leave out the sugar. Your body doesn't need more turmeric. It needs smarter turmeric, integrated into a diet that supports, not stresses, your metabolism. Turmeric isn't a miracle spice. It's a tool. And like any tool, it can build or break depending on how you use it. After 60, your body is telling you something: simplicity is strength. It's not about piling on superfoods. It's about creating harmony between what you eat and how your body responds. That's not trendy. That's biology. Here's the uncomfortable truth that no supplement company wants to tell you: turmeric, for all its golden glory, is pharmacologically active. That means it behaves like a drug, and drugs don't exist in isolation. They interact. For younger people with a strong metabolism and resilient organs, that interaction might be subtle, maybe even beneficial. But for someone over 60, whose liver enzymes are slower, whose kidneys filter less efficiently, and whose prescription list is already long, turmeric can quietly rewrite the script of your medication, sometimes dangerously. Let's start with the liver, the biochemical control center of your body. Every pill you take, blood pressure medications, statins, blood thinners, diabetes drugs, they all pass through the liver's detoxification system. That system relies on a set of enzymes called the cytochrome P450 family. Think of them as little assembly lines that break down compounds so your body can use or excrete them. Turmeric's active compound, curcumin, interacts directly with these enzymes. It can either inhibit them or, in some cases, speed them up. The problem, that means your drugs might not behave the way your doctor intended. If curcumin inhibits those enzymes, and evidence shows it can, your medications stay in your bloodstream longer than they should. So let's say you're on warfarin or another blood thinner. Normally your body keeps a delicate balance between thinning your blood enough to prevent clots and thickening it enough to avoid bleeding. Add turmeric, and suddenly that balance shifts. You could end up with bruising, nosebleeds, or, in severe cases, internal bleeding. All because curcumin slowed down the drug's breakdown. On the flip side, if turmeric induces certain enzymes, it can make drugs clear faster too fast. That means your medication stops working effectively. Picture someone on diabetes medication like metformin or glipizide. The blood sugar control that seemed stable suddenly fluctuates, not because of diet, but because turmeric changed how the drug behaves in your system. Most people wouldn't connect those dots. They'd blame their food, their stress, or their age, not realizing that their healthy turmeric capsule was altering their body's chemistry. Then there's the gut, where a huge part of drug absorption happens. Curcumin doesn't just affect the liver. It also interacts with transport proteins in the intestines, like P-glycoprotein, which acts as a kind of gatekeeper for what gets absorbed. By modulating that gatekeeper, turmeric can either let more drug molecules in or push them out faster. For a 30-year-old, the gut barrier is resilient and adaptable. For a 70-year-old, it's thinner and more permeable. That makes the whole system more unpredictable. Small shifts can lead to big consequences. People often forget that the very property that makes turmeric appealing, its ability to reduce inflammation, is also what makes it risky when combined with medication. Many drugs rely on inflammation pathways for their action or metabolism. For example, nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, corticosteroids, and even certain antidepressants operate in pathways that overlap with curcumin's molecular targets. Add turmeric to the mix, and you might amplify or blunt their effects without meaning to. The result? A liver that's confused, a metabolism that's overwhelmed, and a patient who can't figure out why their prescriptions suddenly feel different. The issue becomes even more pronounced with polypharmacy, the reality that most older adults are on multiple medications. Every new compound you introduce adds another variable. It's like playing biochemical Jenga. One wrong move, and the whole structure becomes unstable. Curcumin, despite being natural, doesn't get a free pass in that equation. In fact, its potency makes it one of the more unpredictable players. Now, none of this means turmeric is inherently dangerous. It's not. But it does mean you need to treat it with respect, the same way you treat any prescription drug. The dose matters, the timing matters, and the combination matters most of all. If you take medications that thin your blood, control your sugar, lower your cholesterol, or regulate your thyroid, you should absolutely talk to your doctor before adding turmeric, whether in capsule form or high-dose supplements. Here's the irony. The very people most drawn to turmeric, older adults looking for natural relief from inflammation, arthritis, or heart issues, are also the ones most at risk from its interactions. It's not because their bodies are fragile, it's because their metabolic machinery has slowed and their chemical load has increased. The line between medicine and toxin is razor thin when your detox systems are already working overtime. So when you see those bold claims, turmeric fights inflammation, turmeric protects your heart, turmeric boosts immunity, remember that it's not the spice alone that determines those outcomes. It's the context. What else is in your body? What's your liver already processing? What medications are competing for the same enzymes? If you don't ask those questions, you're flying blind. Real health isn't about adding more. It's about understanding the interactions between what you already have. The human body is not a collection of parts. It's an ecosystem. And in that ecosystem, every chemical you add, natural or synthetic, changes the balance. For someone over 60, That balance is delicate. Turmeric can be your ally, but only if you know which battles it's fighting and which ones it might accidentally start. If you really want to understand how turmeric behaves in your body, you have to start with the gut, because that's where everything begins. Your gut isn't just a tube that digests food. It's a living, breathing ecosystem made up of trillions of microorganisms that dictate how your body processes nutrients, regulates immunity, and even balances hormones. When we talk about the microbiome, we're talking about your body's internal rainforest, complex, dynamic, and incredibly sensitive to change. And after 60, that rainforest isn't what it used to be. Over time, your gut diversity naturally declines. The microbial species that once flourished start to thin out, often replaced by less beneficial strains. Antibiotics, stress, medications, processed foods, they all chip away at that delicate balance. By the time you hit your 60s, you've likely lost a third of your microbial diversity. That's not just a number, that's a shift in how your body metabolizes food, detoxifies chemicals, and even responds to inflammation. So when you introduce turmeric into that ecosystem, it doesn't land in the same terrain it would have 30 years ago. It lands in a microbiome that's less resilient, more reactive, and sometimes already inflamed. Now, turmeric, or curcumin, its active component does interact with gut bacteria, and not in a trivial way. In fact, most of the curcumin you consume doesn't get absorbed into your bloodstream. It stays in the gut, where microbes metabolize it into different compounds. Some of those metabolites are beneficial, anti-inflammatory, antioxidant. But if your microbial landscape is off balance, those same conversions might not happen properly. In other words, turmeric's healing potential depends entirely on the health of the microbes doing the work. Let's take an example. In a young, diverse microbiome, certain bacterial species like Bifidobacterium and Lactobacillus can break down curcumin into smaller bioactive molecules. These metabolites help calm inflammation in the gut lining, reduce oxidative stress, and support immune balance. But in an older gut, where those beneficial bacteria may be depleted and replaced by opportunistic species like Clostridium difficile or Enterobacter, curcumin can actually irritate the lining instead. It's not because turmeric suddenly turned bad, it's because the system processing it changed. And that's the part most people miss. You can't separate turmeric from your gut environment. If you're over 60 and you've been taking antibiotics, eating a low-fiber diet, or dealing with chronic stress, your microbiome is already compromised. Add turmeric on top, especially in supplement form, and it can trigger gas, bloating, or loose stools. That's your gut signaling distress. It's trying to metabolize something complex without the microbial machinery to handle it. Another layer to this story is the gut barrier itself, what we call the intestinal lining. As you age, this barrier becomes thinner and more permeable. We often refer to this as leaky gut, but in scientific terms, it means that the tight junctions between intestinal cells start to loosen. That allows small molecules, sometimes even bacterial fragments, to enter the bloodstream. When that happens, your immune system goes on high alert. The result? Chronic, low-grade inflammation, the kind that underlies almost every disease of aging, from arthritis to Alzheimer's. Now imagine adding turmeric into that mix. It's anti-inflammatory, yes, but it's also a mild stimulant to bile and gut motility. If your gut barrier is already fragile, that stimulation can actually make the problem worse before it gets better. And then there's the way turmeric interacts with other gut compounds. Many older adults consume turmeric alongside high-fiber foods, beans, or cruciferous vegetables, thinking they're doubling up on gut health. But too much of a good thing can still be too much. These foods are rich in fermentable fibers, which bacteria love to break down, producing gas as a byproduct. Combine that with turmeric's effect on bile flow and digestive enzymes, and you've got a recipe for bloating, cramping, and discomfort. The truth is, turmeric's impact on the gut isn't linear, it's conditional. If your microbiome is balanced, it helps restore calm. If it's unbalanced, it can tip the scales further. The difference lies not in the spice, but in the state of the terrain. So what can you do about it? First, rebuild the ecosystem before you try to fine-tune it. Focus on feeding your microbes, not just yourself. That means real fiber, vegetables, legumes, fermented foods, prebiotics. The healthier your gut environment, the more likely turmeric will act as a healing agent instead of a stressor. Second, if you're new to turmeric or over 60, start small. Don't bombard your gut with high-dose supplements. Let your system adapt. And finally, remember this, inflammation doesn't start in your joints or your arteries. It starts in your gut. That's where your immune system lives. That's where your metabolism begins. And that's where your resilience is built. Turmeric isn't magic. It's information. It tells your microbes how to behave. But if your microbial orchestra is out of tune, even the best conductor can't make the music sound right. You can't out-supplement a broken system. The real goal isn't to consume more turmeric, it's to restore the gut environment that allows it to work. Because at the end of the day, a healthy microbiome doesn't just make turmeric more effective, it makes you more effective, and that's where true longevity begins, not in a capsule, but in the microscopic world inside you. Here's the paradox of modern nutrition. People think that if a little is good, then more must be better. That's not biology, that's marketing. Turmeric is a perfect example. Somewhere along the way, a healing spice became a health obsession. You can find it in lattes, gummies, smoothies, capsules, even face creams. It's treated like nutritional gold. But what most people forget is that your body doesn't thrive on abundance, it thrives on balance. And after 60, that balance becomes everything. The older you get, the less margin for error your metabolism gives you. Your liver, your kidneys, your gut, your immune system, they've all been working full-time for decades. They're still capable, but they're not as quick to adapt. When you were 30, your body could handle the occasional overload, too much caffeine, too much alcohol, too much turmeric. You'd metabolize it, detoxify it, move on. At 60, those same systems are slower, more sensitive, and far less forgiving. Timing, dosage, and combination suddenly become the difference between benefit and burden. Let's start with timing. Turmeric doesn't belong in your bloodstream 24/7. Curcumin, its active ingredient, doesn't store in your tissues like vitamins or minerals. It works in pulses, influencing inflammation, oxidation, and enzyme activity for short periods. That means taking it continuously, especially in high doses, doesn't amplify its benefits. It overwhelms your detoxification pathways. The liver's enzymes that process curcumin are the same ones that manage most medications, alcohol, and environmental toxins. If you're dosing turmeric 3 times a day, or taking those mega curcumin supplements that promise 2,000% absorption, you're asking your liver to do overtime on a system that's already running at capacity. Then there's the issue of food timing. Turmeric works best when your digestion is active but not overloaded. Take it with a balanced meal, a bit of healthy fat, some protein, and complex carbohydrates, and it absorbs better, stabilizes inflammation, and supports bile flow. But take it on an empty stomach, and it can irritate the gut lining, especially if you already deal with reflux or gastritis. Take it right after a heavy, oily meal, and it can push bile production into overdrive, causing nausea or discomfort. So yes, even natural foods obey the laws of physiology. There's a right time, and there's a wrong time. Moderation is the next piece. Turmeric isn't a rescue drug. It's a signaling molecule. It tells your cells how to behave, which genes to express, which pathways to calm, which enzymes to activate. Those messages are subtle. When you flood your body with high doses, you're not whispering instructions, you're shouting, and cells don't respond well to being shouted at. Overdoing turmeric can actually suppress certain detox enzymes, interfere with iron absorption, and alter the balance of gut bacteria. In short, more can backfire, particularly in older adults whose systems are already trying to maintain delicate equilibrium. Another layer most people miss is interaction over time. If you're taking turmeric daily, its cumulative effects build up. Curcumin can linger in fat tissue and influence hormone metabolism. Over months, this can slightly shift estrogen levels, thyroid function, or cortisol rhythms. Subtle changes that might not show up on a blood test but can affect how you feel. More fatigue, changes in digestion, even sleep disturbances. It's not that turmeric causes these problems, it's that unmonitored excessive use throws off your body's internal timing. Your body is a symphony of rhythms, circadian, hormonal, metabolic, and turmeric, powerful as it is, plays an instrument in that orchestra. You have to keep it in tune. That's where cycles and breaks come in. Instead of daily indefinite use, take turmeric in intervals for a few weeks on, a week off. Let your liver reset. Give your gut time to rebalance. That's how traditional systems like Ayurveda